One of the things that I did when I left Capitol Hill is I looked across the various pieces of legislation, ranging from the ADA to IDEA to the Rehab Act to the Developmental Disabilities Act to the Tech Act, and said, are there a common set of principles and themes and values? And can we use that framework for our advocacy? So that whether we're doing Olmstead or healthcare or child care or welfare or job training or education, is there a lens, a guidepost, a set of principles, a checklist, an audit that we as advocates, as change agents, can use to see if our advocacy is touching on the various policies and what I call methods of administration that are necessary so that at the end of the day, the change in policy that we're all advocating for might actually be implemented. Let me start then by going back in time. When we talk about disability policy, we cannot just start with where we are today. We have to go back in history. We have to understand the historical context for whatever it is that we're doing. In this case, if our advocacy is dealing with Olmstead, community-based services and supports, we have to not start with the present, because we need to understand why the systems and the policies are what they are before we start figuring out what changes we need to make. And so we have to start with how we as a nation in general, and then you specifically in terms of the specific issues that you'll be dealing with, how the systems have dealt with people with disabilities. The old paradigm, the old approach adopted by policymakers and many professionals was the notion that a person with a disability had a defect. So people with disabilities were defective and in need of fixing. And if we couldn't fix them, we excluded them, we segregated them, we denied them services. Out of sight, out of mind was the norm. That was the public policy approach to people with disabilities. Let me give you a couple of quick examples. Chicago, up until 1974, had the following ordinance on the books. No person who is diseased, maimed, or in any way deformed so as to be an unsightly or disgusting object is to be allowed in or on the public ways or in other places in the city. If this person, quote, exposed himself to public view, he or she would be subject to a fine for each offense. This was an example of an ugly law. Public education. Folks here from Maine? Anybody here from Maine? Up until 1970s, you had on your books legislation that said if it is inexpedient to serve a child with a disability, the public school system had the discretion, the authority to totally exclude that child. Let me read to you briefly from a Wisconsin Supreme Court case. The issue in this case was whether or not a child could be totally excluded from public education based on the state statutes dealing with education. Merit has been a crippled and defective child. This is the language of the court. Merit has been a crippled and defective child since his birth, being afflicted with a form of paralysis which affects his whole physical and nervous makeup. He has not the normal use and control over his voice, hands, feet, and body. By reason of said paralysis, his vocal cords are afflicted. The school board claimed that his physical condition and ailment produces, quote, a depressing and nauseating effect on the teachers, school children, that by reason of his physical condition he takes up an undue portion of the teacher's time and attention, distracts the attention of other pupils, and interferes generally with the discipline and progress of the school. The Supreme Court in the state of Wisconsin concluded that this child must be or may be excluded from public education because, quote, his presence is harmful to the best interests of the school. Individual rights must be subordinated to the general welfare. How about institutions in your state? The question is, have you researched their history? Do you understand why and how they were developed and who was behind it? Well, in many states, institutions develop because of the work of commissions made up by policymakers and professionals. And in some states, they were called the Commission to Address Feeble-Mindedness and the Menace of Feeble-Mindedness. So if you look at the literature and you look at what folks were saying not that long ago, you'd hear phrases like this in the literature. The feeble-minded are, quote, a menace to society and civilization, responsible in large degree for many, if not all, of our social problems. Why am I talking about all this? Well, one of the reasons is to set how important it is to understand a historical context and understand a mindset. And I'm also sharing thoughts like this because this is not yesterday, this is still today in many systems. But the point of all this discussion is, when you're doing advocacy, you don't start, in terms of policy advocacy, you don't start with today. You have to go back in history in terms of findings and share and explain the whys. The historical context is where you need to start in terms of your advocacy, and that requires the research necessary to figure out in your state what is the history of the institutions. But it's also the mindset of policymakers and staff and professionals who are not working day in and day out on disability policy.